I'm Dr. Rocco Piazza, board-certified plastic surgeon in Austin, Texas at the Piazza Center, and I'm thrilled that you're here with us today. We are going to talk about Im Sculpt Neo, which is the latest technology in muscle building and fat reduction to enhance things like your abs, your core, glutes, hamstrings, quads, biceps, and triceps. We brought this technology in after careful evaluation of the different types of treatments used to enhance muscle mass. And we wanted to have something that was different than Coolsculpting, which we already have in the practice for fat reduction. We're really excited that you're here, and we hope to be able to explain everything about this device and why we think it's right for you. We also want you to know that it's important to stay till the end. We've got a live Q&A planned for you at the end of our discussion today, and we want to be able to answer all of your questions. So, during the presentation, make sure you use the Q&A box to write whatever comes to your mind, because we want to be able to cover all of these things for you today. Thank you for joining us. We brought this technology into our clinic because we've done a lot of research on what the very best muscle building technologies are in our marketplace. And what we found is that this particular device enhances muscle mass up to 25% and reduces overlying fat 30%. The added benefit of treating the abdominal or core muscles is that it actually reduces intra-abdominal fat or visceral fat. Now, that's one of the top reasons why we brought this in, but there are a few other reasons as well. First of all, this is a 30-minute treatment session, and we know that you're busy. We're busy too, we get that. So we wanted something that was super efficient for you, that would allow you to do this on a lunch break or work it into your day once a week so you could see proven results in 4 weeks. The other thing that we love is that there's no downtime with the device. So with your treatment, you have zero downtime. You can go back into your normal routine as if you just had a great workout, feeling energized and ready to focus on your day. And lastly, we know based on the clinical studies and our own clinical experience that you will see results as early as 4 weeks. And that for us was a no-brainer in considering this technology. When we reviewed the technology that exists with regards to muscle enhancement or fat reduction, we didn't really find anything that compared to Im Sculpt Neo. Im Sculpt Neo uses radiofrequency therapy to heat up the soft tissues while simultaneously contracting the muscle. We know that each 30-minute session is equivalent to approximately 20,000 contractions. So if you think about your core muscles, that's doing 20,000 crunches. Our proprietary method and process here is to first soften your area of treatment using hypervolt or vibratory therapy. We also couple this treatment with Transform Body made by Elastin Skincare, which we know builds collagen and elastin in the skin and also reduces subcutaneous fat. All of these things are meant to tighten the skin over the treatment area, enhance your muscle mass, and reduce fat. So we're super excited because we know that in our clinic, we definitely have something that's different than everybody else. Currently, this device is indicated for treatment or enhancement of the abdominal muscles or core muscles, the gluteal muscles, the quadriceps, the hamstrings, the biceps, and triceps areas. There is new treatments that will be available in the near future to focus on the sides of the waist, also as the flank area, for both adiposity or fat reduction, as well as oblique muscle enhancement. The exciting thing about this technology, as well as our focus on multi-modality treatments or combination therapy treatments, is that this treatment can actually be coupled with Coolsculpting. So Coolsculpting, a single session results in about a 22% reduction in fat in the treatment area. When you couple this with Im Sculpt Neo, you're getting an even further enhancement of fat reduction. Our goal is to try to get rid of those hard to lose or stubborn areas. Most commonly, this is stuff that's driven by cortisol or stress in our lives. It makes us hold on to fat, like for instance in the lower tummy, sides of the waist. So we're actually really excited because since we have an approach for multimodality or combo treatments, this fits right into our clinical practice. The exciting thing about this technology is that most everyone is a candidate. We found that patients who want better core strength or even postpartum and need strengthening of their core muscles or rectus diastasis correction, that this can help. The clinical studies actually show that up to a 19% improvement in rectus diastasis can be had with 4 treatments of Im Sculpt Neo. It doesn't completely correct it, but it can definitely help with the stability of the oblique and abdominal muscles. Contraindications for the abdominal treatment are patients who have umbilical or inguinal hernias or repaired umbilical or inguinal hernias. Also, patients that have implantable metal may or may not be a candidate for this treatment. But that doesn't mean you can't treat glutes, quads, hamstrings, biceps, or triceps if those areas are unaffected. In addition, anybody whose BMI is over 35 is not a candidate for this procedure at this time. However, if weight reduction happens, and we're so happy to participate in that weight loss plan with you, you can absolutely be a candidate for this treatment. Early results from this treatment can be seen as quick as 4 weeks. Maximum results are at 12 weeks. But with any treatment, it is important to understand that your commitment to exercise and healthy living do impact the quality of the result over time. We find that many of our patients will do a quarterly or even monthly maintenance treatment on the treated area in order to ensure great muscle strengthening and really nice control over that result for the near future. We recommend a minimum of 4 to 6 treatments in the treated area. And these treatments are done 5 to 7 days from one another. So typically once you start your treatment cycle, best results are realized when you have a commitment for 4 to 6 weeks. We also know that early results can be seen as quick as 4 weeks out from your first treatment. In addition to that, maximal results are typically achieved at about 12 weeks. Many of our patients will participate in a maintenance program and have an Im Sculpt Neo treatment to the area they've treated once per quarter or even as quick as once per month. But that's very dependent on your desired results. As with anything, healthy eating, great balance in your life, decreasing your stress, and a commitment to exercise enhance your results no matter if it is surgical or non-surgical. Thank you very much for joining us today. We hope this was informative and that you understand much better why we think Im Sculpt Neo is an incredible treatment offering. Say yes to the text so we can get you in for your consultation to get you started today on your treatment series. Also stick around for the live Q&A. We're about to answer some questions. Thank you for putting them in the box. If you've not done that already, please ask your questions. We're really excited to answer them for you. Hi, everybody. I hope you can hear me. If you can't hear me, definitely let us know in the chat box. Hi, Annie.
Everyone. Hi, how are you?
Looking forward to doing this Q&A with you. I apologize, guys. I'm kind of downtown right now at the Codependent. They were gracious enough to let me use one of their spaces to do this. My house is under construction. It's so great to do this and to go through all these Q&As. And I want to introduce Annie to you guys. Annie's a master esthetician. She's also a laser certified and certified Coolsculpting tech. She has experience using Im Sculpt, the classic version of Im Sculpt prior to Neo, and then has been recertified now on Neo. And so she had experience using this. It was in Kansas City, wasn't it, Annie?
That's right.
So now in Austin, we launched Im Sculpt Neo after doing a lot of research and passing on Im Sculpt Classic a few years ago. We felt that it really wasn't a wow result, and we weren't seeing, in the studies, we weren't really seeing a lot of clinical evidence that it was effective. So we ended up revisiting this idea when they approached us, about a year and a half, 2 years later, and felt that the technology had advanced so much that it made sense. The clinical studies were there to support the data. They had added radio frequency energy along with the electromagnetic energy, and that had changed the results for so many people. So what we'd like to do is that we're going to take these questions. I'm going to kind of go scroll all the way down to the very first question, and we're going to work through these questions with you guys. As questions come to mind, please enter them in the chat box so that we can answer them for you. So our first question that comes up is your Im Sculpt treatment process the same as other practices or processes? As many of you know, Im Sculpt Neo is offered in more than one place in Austin. And what sets us apart is that we really pay attention to the entire experience for our patients. So part of what we do I'll let Annie elaborate on this. Annie?
Absolutely. So what's different between us from other practices in Austin is that I would say that our use of the Theragun and also our transform body that we use during our treatment. I've been to, at least at the practice that I worked at prior, we actually had the classic Im Sculpt, and we did not do this as prep beforehand. And what's different about it is that we're stimulating blood flow before the treatment and after. And so it just starts that process of that natural fat elimination. And so I would say that's something that would be different to other practices that we do. And also we really pay attention to what that patient is wanting, what area is affecting them most, and we make sure we target that very critically.
We have, I think one of the other things we do, Andy, is we also have digestive tonic waters that you can choose from as well that help to improve overall just the way the stomach's flowing and to decrease bloating and things like that. And
That's
lastly,
right.
when we finish our treatment, we believe in elastin transform body for both Coolsculpting and Im Sculpt, because what it does is it boosts elastin and collagen production in the skin. It has an additive component that bypasses and gets through the dermis into the subcutaneous tissue that causes additional fat loss. So we're trying to really boost that so you get the most effective treatment in the treatment area. The second question we have, Annie, is about does Im Sculpt burn fat as well as Coolsculpting? And I think what we have to understand here is this is a totally different mechanism of action.
Totally
So
different.
Coolsculpting, it freezes fat and it goes away permanently. Im Sculpt is basically causing the muscle to really work to its fullest potential. So what the electromagnetic stimulation is doing is it's working out the entire muscle. It's causing every one of those muscle fibers or fascicles to work. And that's different than when you go to the gym and do a crunch. When you go to the gym and do a crunch, you're going to work a portion of that muscle, but it's unlikely you will work the entire muscle. So when we work the entire muscle like that, the muscle sends messengers, so to speak, chemical messengers to the surrounding soft tissue. And the first area where we see fat burn is in the surrounding soft tissue, right there adjacent to the muscle. And so that's what makes this really different. Coolsculpting, we're freezing that fat and we're destroying that fat, and Im Sculpt is using that fat. I hope that makes sense. So the muscle's using that fat. Did I do a good job answering that, Annie?
Absolutely. I would say the process is different just because Coolsculpting, what it's doing is it's causing cryolipolysis within the scale. So that means it's killing the cell with freezing cold. And then with Im Sculpt, it's using that radio frequency, which is heat. We're heating that tissue to about 42 degrees Celsius. And so when that happens, basically those lipids inside the cell start to drain into our bloodstream safely. That starts that lymphatic process of draining into our lymphatic system. So the claim is that Im Sculpt can decrease fat by 30% and Coolsculpting is by 25 to 20%. Every patient is different. So sometimes people will respond better to Coolsculpting and sometimes people will respond better with Im Sculpt. But I would say Im Sculpt, because it has that muscle stimulation, I would say it's way more effective for those patients that are looking for toning, that already have a really great workout regimen for them.
I think, Andy, one of the questions that you kind of touched on already that I see here is, can this be combined with other treatments? And I know that Coolsculpting and Im Sculpt, you're doing a lot of that kind of simultaneous. Can you explain what's going on in our clinic?
Absolutely. So of course you can combine Im Sculpt with any type of treatment that we have in the office. Commonly that I'll have patients combine with Coolsculpting and Im Sculpt. And that's just because Im Sculpt does not yet have applicators that are appropriate for, let's say, flanks, which is the side of your abdomen or on your back. And so we'll combine that Coolsculpting technique just to basically contour those areas that Im Sculpt does not have those paddles yet for. And then either that same day, we'll go into Im Sculpt and treat another area that they're wanting to work on. You have to wait a month after Coolsculpting for the same area to treat with Im Sculpt. So for example, I do abdomen quite a bit. We'll go through first with Coolsculpting to treat and debulk the area. And then later on, after a month or so, once that patient feels comfortable and doesn't have any residual swelling or numbness left from the Coolsculpting treatment, we'll go through with an Im Sculpt paddle, and that will help tone and tighten that area for that patient.
Thank you, Annie. I think that's a really good overview of how you're using these two technologies to achieve excellent patient outcomes. One of the questions that we have on here is regarding treating two people at the same time. And I know we're doing a lot of that with regards to abdominal stuff. Can you explain a little bit about that?
Absolutely. So with our Im Sculpt machine, we actually have two paddles. Some areas of the body do need two paddles, such as glutes, quads, calves, arms. Obviously need two paddles for those. But for some patients that have a lower BMI, they only need one paddle for their abdomen. And so you can bring in your partner, you can bring in a friend, and you guys can do your abdomens at the same time. And we can treat you guys with a custom treatment for both of you guys, because I don't know if you guys saw in the video, but I do have little levers on the side of that machine that I'm able to customize for those patients. And so it's a really fun experience. And that way you guys can joke and laugh and, have a really fun time while you're getting treated.
I know that we've really called this Im Sculpt Neo Duo, where two people can do their abs at the same time. And I know that there's a value add for that, meaning that it's like half the price of what it normally is for four sessions.
That's right.
And that allows two people, couples, friends, things like that, to be able to have these treatments simultaneously within 30 minutes. And this treatment is equivalent to 20,000 muscle contractions. So it is a significant number of muscle contractions. I have a question on here, Annie, and it might be good if I target this one, but question is, would Im Sculpt Neo help diastasis rectus or rectus abdominis? My diastasis goes the entire length of the abdomen and approximately a 2 to 3 finger split or 2 to 3 finger distance at the widest part. And the answer to that is no, it doesn't correct it completely. But what it can do is enhance the core. It can bring the muscles a little closer together. It is not a rectus diastasis repair. However, the question that I pose back in the situation is, if the abdomen is really protuberant all the time, that is a surgical repair. Okay. If the abdomen is mostly flat, unless you relax, when you relax, you see a little bit more of a rounder shape. This is a great candidate for Im Sculpt. And the reason why I say this is that I take care of patients all year long with regards to tummy tucks. And, there's a lot of misinformation about what can be done from physical therapy and all these other things about how you fix this. And I will tell you that I've never seen an exceptional physical therapy regimen fix a 3 centimeter or 3 finger width diastasis. It's very difficult. So there are candidates where we can absolutely improve the resting tone of the abdomen, and we can fix the shape to some extent. And what I think is most powerful about this is the control over your core after completing a series of treatments. And you'll notice even after the first series that when you go to contract your abs, you feel your abs and your obliques engage way different than they did before the treatment. And over the course of time, you'll notice that control is even more powerful. So I would say you can see some improvement when you have, muscle, I would say lack of responsiveness to the core muscles after undergoing pregnancy. I think it's a great first step, especially early on postpartum. It can be a great first step to try to get that resting tone back as you're moving through the first 3-4 months after having a child. I think long term, for severe diastasis that extends the entire length of the abdomen, a surgical repair may be better suited to help you get where you want to be. I hope that answers that question. There's a question here about cost per treatment. Annie, can you go over that?
Absolutely. So for y'all that are joining us with our virtual event, we have a very special event price for you guys. Usually with Emsculpt, if you're wanting to do 4 treatments, it's the same no matter what type of area you're wanting to treat per treatment. Usually for us, we charge about $3,400 for a series of 4 treatments, but for today for you guys, we would be willing to get that to you for $2,800, so you'd have about $600 in savings. And then for 8 treatments, that's usually about $6,800, and then we would bring that down to $5,200 for you guys. And so after that, it would actually go very quickly. I would see you guys on a weekly basis to come into the office for that.
So treatments are typically 5 to 7 days apart when we do these treatments. So that's how you get the best result. If you do a treatment and go out of town for 2 weeks, it's really, you're not setting yourself up in the right place. So 5 to 7 days is what we recommend between your first 4 treatments. Some patients will do a series of 6 treatments. Most will do a series of 4. And then after that, usually maintenance would start if that's something that you want to do. And this is just keeping those muscles super engaged in addition to your normal workouts. You could do once a month or once every quarter. I've started my first post-series treatment 4 weeks after my last, and it was a big difference, meaning that I had seen a significant improvement in the overall shape of my abdomen. And with that single treatment 4 weeks later, I was like, this is mind-blowing. I can't do this in the gym. With regards to our next question, I've got some more questions on here. Let's see here. Hold on one second here. What does it feel like? I've got a question about what it feels like. Can you talk a little bit about that, Annie?
Of course, that's a fair question. Emsculpt, it's such a hard feeling to describe. For example, if you're doing it on your abdomen, it's almost going to want to push you into a crunch or a sit-up, so it is flexing those muscles for you. I would say that it will never feel painful. That's what's great about this treatment, is it's not painful. There's no downtime, no swelling, no anything that you have to worry about afterwards. It's just during the treatment, it really feels like you're doing an intense workout. So, if you're going on your arms, such as triceps or biceps, your arms are literally going like this, like you're lifting something, which is really cool. So I would just say the muscle contractions feel a little bit weird, but then there's another portion where it's doing tapotement, which is tapping. And so basically that's just tapping out the lactic acid in your muscle. So that way you actually don't feel sore after the treatment. Patients will always come in and be like, I didn't feel sore. Did it do anything? And I was like, that is exactly its job. You should not feel sore after this treatment or anything. That makes it the perfect summertime treatment for y'all. It's such a weird contraction. It's just like you're about to do a sit-up, but it should feel very comfortable throughout the treatment.
We never want somebody to be uncomfortable, and there should not be pain with the treatment. So that's very important. And we have a scale of 1 to 10 that we can adjust our settings with regards to both radiofrequency and electromagnetic stimulation intensity to ensure that we're getting an effective treatment. So we will take you as high as we can take you in each of those parameters, as long as you're not hurting. And that's the most important thing. Pain is not to be expected, and you will feel more control after this procedure, and the tissues will feel warm after this procedure, but you should not feel sore as if you'd gone to the gym and overdone something, and now you can barely move for the next 3 days. It does not do that because of the way the device is programmed to get rid of the lactic acid in the muscle for you with a series of contractions. I have a question about specifically about swelling after Emsculpt. Annie, are you seeing any swelling after Emsculpt Neo treatments?
None whatsoever. The only thing that I can say that patients will notice right afterwards is because there is radiofrequency associated with the treatment most of the time. On the paddle, it's actually a big circle. So you'll notice like a mildly red circle on your abdomen or wherever we're treating, and that will go away within 30 minutes, maybe an hour for patients that have more sensitive skin types. But besides that, there is no swelling. Just as Dr. Piazza was saying, there is no residual soreness or anything like that. Absolutely no downtime. You feel absolutely amazing right when you get up from Emsculpt. It's just exactly like you did a workout.
I've got a question about focusing. This question specifically says, since Emsculpt focuses on building muscle rather than losing fat, is weight loss still an expected result? And I think one of the things we want to touch base on is that Emsculpt and Coolsculpt aren't weight loss treatments. Okay, so that is really important to understand. So if you weigh yourself and then you have the treatment and then you're expecting to weigh less, That's not possible. So anybody who promises that they're not telling you the truth. These are contouring treatments, and there's a difference. Weight loss comes with, exercise, healthy eating. There's a lot of crazy factors that come into that, and including hormones and all those other things, especially that we don't have so much control over. And especially many women really go through, this every month, right, with cycles and hormones and all the changes. But this is not a weight loss treatment. This is a contouring treatment. So our goal is to enhance muscle form, function, and mass. And not so much that all of a sudden now you look like a bodybuilder, but to enhance it, to create lean muscle mass. And the way it does that is by increasing the overall working potential of that muscle and simultaneously triggering a series of natural events where the fat on top of that muscle and around that muscle decreases because of the fact that the muscle is being worked out so effectively. So is it permanent? Does it stay? If you do no workout and you do nothing and you don't eat healthy, no, nothing is going to stay. Even surgery won't make you look the way you did at the time of surgery. So you have to understand that these treatments are to help enhance what you're already doing. This is to take things to the next level. And it can be a great launching point for patients that are in the process of kind of figuring out where they're going to go with their fitness and their exercise. I hope that helps answer the question. We've got a question here about Im Sculpt Neo getting rid of leftover lipo lumps. And I think we're talking about focal areas where maybe there's a regular contour from liposuction. What are your thoughts on that?
For personally, as a provider, my first indication would be to go towards Coolsculpting for that type of concern, just because Coolsculpting is definitely more of a debulker, and then we can go through afterwards with Im Sculpt Neo just to make sure we're smoothing out everything. Not that Im Sculpt Neo wouldn't be a good choice. I guess it really just depends on what part of the body and if you are a candidate for Coolsculpting at that point. But I would say Coolsculpting for liposuction that's not settled would be my first indication. And then going through with Im Sculpt later to smooth out that skin and make sure that we're stimulating collagen and elastin in that area.
So in areas where there's a focal contour irregularity that could happen from liposuction or from weight gain after liposuction, some of the treatments are Coolsculpt Mini, which is a very small applicator that can fit over tiny areas. And so we use a sizer to make sure that that's the right choice. Other things are Kybella, which is a dissolves fat. It's an injectable that can be used. And then lastly would be doing revision liposuction or fat transfer in areas where there are deficits from too much fat harvested. So those are some of the different treatment options when there's a regular contour. I've got a question here about treating triceps. If you treat your triceps, Annie, do you have to treat your biceps?
No, not at all. I would say triceps are ideal for those patients that are seeing loose hanging skin in that area or really wanting to tighten. We've all seen, if you, I don't want to say, what is that word? When you just have that loose hanging skin right here, I would say that the Im Sculpt Neo is superior to the Coolsculpting, just because with that RF frequency, we're actually going to be able to tighten that skin. And so I've seen a lot of really, really great results with treating tricep. It's totally up to you. If you are wanting that nice contoured look to your arm, you can definitely go through with your bicep if you'd like to. I would say that is definitely more popular with my male patients than my female patients. Female patients usually will just go for their triceps. Im Sculpt, I would say, how Dr. Piazza was saying, it's definitely not going to help with weight loss, but it's more inches. So if you're treating your abdomen, you might lose some inches around your abdomen. And the same goes for your bicep. You're going to gain inches in your bicep with treating with Im Sculpt.
I think it's important to know for arms, which becomes a bothersome area as we move through the years, especially the area from the elbow to the armpit or axillary area. My Aunt Betty had these arms that she always would say that she would wave and then they would wave. But this area has become an area we can start treating a lot earlier and treating it with muscle enhancement using Im Sculpt. We can debulk with Coolsculpting. We can also decrease fat or adiposity in the area with the profound radiofrequency sub-Q treatment and use profound radiofrequency microneedling dermal to help tighten the skin. And we're seeing some really incredible results. And I know there have been pictures put on our Instagram that showcase some of those results. And it's a great non-surgical way to treat the arms, because traditionally what we have to do is make an incision that goes from the elbow to the axillary area. And that just is something that most people don't want to have on their arms. You feel self-conscious about wearing something that's short sleeve, etc. So something to think about for sure. I've got a question here on regarding, let's see, oh, I just passed it up. I'm so sorry. I got a poor Aunt Betty. What about okay, so here's this question. Sorry about that. I'm trying to read through these. This is a question about rectus diastasis again, and it's talking about kind of a pooch or round shape that shows up only when doing sit-ups. Would this still help? And I would say in this situation, I would absolutely do Im Sculpt before having a tummy tuck. So if it's only the times when you're trying to really engage your core that you're seeing your core work less effectively, I would do Im Sculpt first before doing an abdominoplasty. Because if that's your only concern and you like the way everything else looks and the skin quality is great and the belly button shape is nice, and then I would absolutely move towards Im Sculpt over a surgical repair. I've got a question on here regarding special diet helpful in creating optimal results. Do you recommend any special dieting, Annie, with regards to this treatment?
Personally, I'm not a big fan of diets. I don't think that they're, if you do lose weight, it's more than likely that you're going to gain it back within a few years, because I feel like they're not something that people can usually keep going with in life. And so, for me, diet, I would just say make sure that you're just getting in your daily dose of greens, making sure that you're eating nice whole foods and nothing that's processed, stay out of the middle aisles of the grocery aisle. But in terms of diet, I would just say make sure that if you'd like to, you can go ahead and go into a calorie deficit diet if that's something that you're trying to work on, debulking. But also, since Im Sculpt is building that muscle, and what we're doing is we're breaking down that muscle and then repairing it back up, I would say making sure that you're getting enough protein in your diet is very, very important for this treatment.
Thank you, Annie. I've got a question specifically on enhancing certain muscles. For instance, this particular question is referring to working on just one gluteal muscle that's functioning less than the other gluteal muscle, with some gluteal muscle weakness. Would that be an option if somebody wanted to work on one area versus two?
100%. So with Im Sculpt, of course, we always go into a consultation just so I can get a look at the area that you're wanting to treat. And so we can see those irregularities, and we can always go in and even them out. So maybe we might do that for one, but usually for glutes, I'd want to treat them both. That way they're getting that same muscle stimulation. And we can always, like in the video, how I was saying earlier, you can always custom which paddle, how hard one paddle is working compared to the other. So for example, for that patient that their right glute is firing more than their left glute, we will turn down how much that hyphen is going for them, which is that magnetic field that is causing that contraction within the muscle. We will just turn that down a little bit lower than the other paddle for that left glute that is not firing quite as much as the right one. And we'll turn it up just a little bit higher so that glute can work a little bit better.
I've got a question following up on that with the gluteal paddles working the glute medius specifically. And I think that there are, several different gluteal muscles that are there, medius, maximus, minimus. But I think what's important to understand is we're getting a whole glute workout. So it's not just targeting on one of the muscles, because all of the muscles under that pad will be affected. Plus, that electromagnetic energy radiates out from the paddle. So it's not like it just comes down in a single line. It's going to radiate out almost like a megaphone, so to speak. So it will affect all of those. And it does penetrate deep into the tissues. I've got a question in here about the back bra area. I have just a couple questions left, guys. Sorry. I know these are a lot of great questions. Great questions.
Good questions, yeah.
Back bra area. How do we treat that? And does Im Sculpt have a role there?
Unfortunately, Im Sculpt does not have a paddle quite yet for that area. That definitely is a Coolsculpting area. Like what Dr. Piazza was saying, we have very little applicators that are able to grab onto those little fat pads perfectly. And so example for that area as well, there's not really, your lats are right there, but in terms of the fat, you're not wanting to work out that muscle. You're wanting to basically just debulk that fat in the area. So not quite yet. Im Sculpt has not come out with a paddle specifically custom for bra fat. I would say Im Sculpt would be the superior treatment.
And lastly, we've got a question about using Emsculpt for facial muscles as an alternative to filler. And I can answer that. Filler is used to replace loss of volume. And so, no, Emsculpt is not currently being applied to the face, the neck, or the face at this time. And it's contraindicated on the chest because you have your heart here. So at this time, no, the answer is no. And I don't know what they have in their pipeline for advancing this technology. It would be interesting to see. But as you know, may know, we have 3 really incredible advanced nurse injectors, April Daniel, Alison Kothman, and Haley Pena. And they have combined, it's hard to imagine because they look so amazing, over 30 plus years of experience, and just really exceptional providers. So consultation is always, really the best way to start. And we really love our trademarked Visia consult, our skincare consult process, because we're able to take a deep dive into the skin, volume, texture, pores. So please text us or let us know if that's something you're interested in. We would be happy to set up time for you to do that with Devin. Other than that, we really thank you so much for joining us today. I think one of the best ways to get started is to Emsculpt Duo Neo or Neo Duo and grab a friend and try your abs and be like, okay, because I think once you feel it, you're going to be like, this is a no-brainer.
You're hooked.
We're really excited to have this technology, and we're so excited that you gave us some time today to do this. And Andy, we review those the specials for this promo for today's webinar.
Of course, yeah. So for you guys that have joined the virtual event with us, we are going to be offering 4 treatments at $2,800, and they're usually $3,400. And then for 5 treatments, we are offering them to you at $5,200 instead of $6,800. And then accompanied. Sorry.
Yeah, does this combine anything else like Elastin or anything like that?
Not for this special, but I definitely recommend those for sure. Elastin Transform and Body Firm. Body Firm is 3.8 fluid ounces is at $150, and then 8 fluid ounces at $260, and then the Transform Body is at $205. And those will just help that natural process of fat elimination, and then also help with crepiness of skin and save that integrity when you're doing body contouring, such as Coolsculpting or Im Sculpt.
Well, thank you very much. Make sure you answer your text or let us know how you'd like us to get in touch with you. We hope you have an amazing rest of your week. Happy Thursday, and thank you again for joining Annie and I.
Thank you, everyone. So great to see you guys.
Bye-bye.
Bye.